Thank you. Good morning on this beautiful Monday morning. I'd like to call the meeting of the Senate Committee on Finance to order. Secretary, would you please call the roll?
Senator Dennis, Senator Kekeffer,
Here.
Senator Goycochea,
Here.
Senator Hammond,
Here.
Senator Ratty, Senator Severs-Gansert,
Here.
Senator Cannizzaro,
Here.
Senator Dondero Loop, Chair Brooks.
Here, and we do have a quorum. I'd like to remind all of the members of the committee to mute themselves when they're not talking and try to keep your camera on so we can maintain a quorum during the meeting. And if you have questions, I'm not having a functioning Teams this morning, so we'll do it old school and raise our hands, and I'll call on you. I'd also like to remind the public that the last agenda item today is going to be public comment. And as usual, you can look at our agenda, and there's all the information you need on how to sign on and log in and make yourself available for public comment at the end of this meeting. Or you can go to the legislative website, the NELIS portion of it, NELIS, and there is a banner on the top that helps you guide you through the process. And today we have three bills. We have Senate Bill 93, Senate Bill 185, and Senate Bill 233, and I'll take them in that order. And I will start with Senate Bill 93, and Senate Bill 93 revises provisions relating to Medicaid. I believe we have Senator Settlemyer here this morning to help present that bill. Senator Settlemyer, welcome.
Thank you, Chairman Brooks. I appreciate it. I also have Senator Hardy here. This bill is kind of divided into two sections. The first one, Section 2, is the bill that I brought forward. We combined it with Senator Hardy, who has a second section, Section 3. And if acceptable to you, we would explain them in that order and probably explain them both and then allow for questions if that works for you, Mr. Chairman.
Yes, sir.
Okay. Section 2 comes about from a constituent of mine who unfortunately is wheelchair bound. And however, he is perfectly cognizant and capable of taking care of himself mentally, unfortunately not physically. And with the current system that now exists, he was having trouble finding care attendants. Obviously, when the economy was doing well, the concept of finding someone for the pay scale that was allowed under Medicaid through other individuals created a situation where he couldn't find anyone to do that work. And because of that, he was unfortunately placed in a hospital for 13 months, even though he had his own home. And even though he had the capability to have a job and take care of himself in many respects, just not physically. What this bill would allow to be done would be for the state Medicaid to create a system or continue the system, what's called personal care services, providing personal care assistance. In other words, he wouldn't be in charge of his own care. He would be able to hire his own individuals and not have to go through an outside company. This would allow him then to have that delta between what the government pays and then what the person is paid to take care of him. He would be able to use that full delta, again, for that ability to hire someone at a higher rate. And then at that, he'd be able to finally be able to stay back in his own home on a more consistent basis. That is the first portion of the bill, Section 2. If you're acceptable, I'll turn it over to Dr. Hardy for Section 3, unless you wish to ask questions at this time.
No, let's hear from Senator Hardy, and then we'll open it up to questions.
Thank you, Mr. Chair. The Section 3 talks about the conundrum that we have when we release a prisoner from incarceration. She have to apply for Medicaid, and that process is not one fraught with alacrity, and so it takes time. And in that time, we have a certain amount of medical needs. Many of the people in incarceration are there for drugs, and so the recidivism is an issue while they're waiting to be cared for with medication-assisted treatment, for instance. with buprenorphine. And so we actually we're not enhancing the ability for them to get treatment quickly when they immediately get out of prison. And so this bill is designed to allow them to suspend Medicaid, which means that it can be put into place immediately after they get out, as opposed to terminate Medicaid. If we terminate Medicaid, they have to apply anew, and that is one of those time-consuming things. If we suspend Medicaid, then it can be done very quickly, and that's what the bill, Section 3, is about. So that they will qualify for Medicaid, but we don't want to terminate it because of the time lag, and thus we will decrease recidivism and improve their health and the health of their families and the health of society. And that's what basically Section 3 does. Again, I will stand for questions as you would prefer, Mr. Chair.
Thank you, Senator Hardy. And welcome, Senator Ratty. Now, do any of the committee members have any questions for Senator Settlemeyer or Senator Hardy? Senator Sievers-Gansert.
Thank you, Chair Brooks. So do you know what the frequency of, after you apply for Medicaid, of having to kind of re-up to make sure that you continue to qualify? So just thinking about you, if you qualified when you went in, and then if you're going to be qualified when you should be qualified when you go out, but then how frequently do they check on that to make sure that we can keep them in that system? If there's a way to suspend them, I guess that's part of it. Is there a way to suspend them so they can continue and not have to requalify?
Now, I'm going to kind of divulge something that maybe I'm not supposed to. They have figured this out, and they are moving towards doing exactly that within the system. So they recognize that it's hard to make money in prison, at that whatever astronomical salary you get when you're working in prison. So you will qualify for Medicaid immediately, but the process takes time to get it. So even if you were on Medicaid before, then you didn't get rich while you were in prison, you're going to qualify again, and therefore you're going to be able to have to reapply if they terminated your Medicaid, as opposed to suspended it, which will be immediately. Now, one of the caveats is when you go to the hospital, if you're in prison and you go to the hospital, your Medicaid takes over immediately when you're in the hospital. The state is responsible for paying all medical costs while you're in prison, except when you leave prison, go to the hospital for an emergency, and then Medicaid is the payer of default, I guess I'll say. And I suspect there's some prison people that are online that can clarify that.
Thank you. Yeah, I was just trying to figure out sort of the pattern. So, because if they're in prison for a long time, they may have been dropped totally out of the system. So as long as they can pause it and then pick it up, that would be helpful, I'm sure. Thank you.
Thank you.
BPS, can you see on the phone line anyone from Division of Healthcare Financing and Policy or from Division of Welfare and Supportive Services for me?
Chair Brooks, this is Broadcasting Production Services. Yes, we will ask about that in just 1 second here, if you don't mind us finding that out for you.
Thank you. Appreciate that. Now, do any of the committee members have any questions, other questions for Senator Settermeyer or Senator Hardy? And my question is, when I look at the fiscal note associated with this, it looks like it's just for the additional services identified in Section 2 of the bill, and not for any of the services identified in Section, or the new process identified in Section 3. And you might have answered my question for me, Senator Hardy, in that you said it looks like they're kind of going to this process already and kind of figured it out. Maybe that would indicate why there doesn't seem to be a fiscal note associated with that. So I want to confirm that with representatives if they're on the phone. But does that line up with what your understanding is, Senator Hardy?
Correct. And if I may, on section 2, it's interesting because when we look at the Americans with Disability Amendment Act of 2008, the concept of digestive, bowel, and bladder is a disability. And so when somebody says, I would never do a job like that, you couldn't pay me enough, that's the kind of thing that these people are trying to deal with. And if we can take care of them at home, it's a whole lot cheaper than it is if we put them for 13 months in the hospital. So yes, there's a fiscal note. The fiscal note, if we don't do it, is probably much greater.
Thank you. I appreciate you identifying that. And so I think we do have Mr. Burrell on the telephone lines, but if we could just have Mr. Burrell on the telephone line confirm that is the situation with a fiscal note, then I would appreciate that.
Chair, may I please have you say the name of the gentleman that you're looking for again, and I'll be glad to see if he's on the telephone line.
Yes, it's Mr. Burrell, B-R-R-E-L.
Mr. Burrell, if you have called in on the public comment line, please press star 9 now. Mr. Burrell, please press star 6 now to unmute yourself. Thank you, Mr. Burrell. Please proceed.
Good morning. This is Phil Burrell, Division of Healthcare Financing and Policy, Deputy Administrator. Yes, to confirm that question right there, Section 3 in the bill requires the department to suspend and reinstate Medicaid eligibility for a recipient who's incarcerated. We'll note that the capitation for recipients in managed care are paid for on a complete month, and suspension of eligibility mid-month will not result in a partial month recoupment of the capitation payment. So as a result, this section will not have a fiscal impact on the division. And we're speaking specifically to Section 3 here.
Thank you. That's what I was looking for. And we have Senator Kiefer has a question.
Yeah, thank you, Mr. Chairman. I noticed in the fiscal note that the calculation of the fiscal note and the fiscal impact was based entirely on waiver population. Are there no non-waiver Medicaid recipients who receive personal care attendant services that would be impacted by this, or is this exclusively for waiver?
And Mr. Burrell
This is Burrell. There we go. Sorry, that's on mute again. Yes, there are, but we would need to confirm. This is Phil Burrell, Division of Healthcare Financing and Policy. Yes, there are, but we didn't count them as a part of the fiscal note, so we can follow thereafter.
So, I'm sorry, for clarity purposes, Mr. Burrell, there are either fee-for-service, well, I guess it would be all fee-for-service folks who receive personal care services that would be impacted by the bill, but they're not incorporated into the fiscal note. Did I hear you right?
This is Phil Burrell, Division of Healthcare Financing and Policy. This is as a waiver service only.
So the fiscal note is comprehensive. There's no one else who would be impacted who's outside of the waivers.
Correct.
Okay. Thank you.
Thank you. Thank you for that clarifying question, Senator Kiefer. Thank you, Mr. Burrell. Do any of the other members of the committee have any other questions for either our division representatives or for Senators Hardy or Settlemyre? It looks as if we do not. So I think we will go to the phones, and we will go to the phone and for any testimony and support right now.
Thank you, Chair. To testify in support on Senate Bill 93, please press star 9 now to take your place in the queue. Once again, we are currently in testimony in support on Senate Bill 93. Please press star 9 now to take your place in the queue. Chair, there are no callers in support at this time.
Thank you. Can we go to any callers in opposition?
Certainly. Thank you, Chair. To testify in opposition on Senate Bill 93, please press star 9 now to take your place in the queue. Once again, to testify in opposition on Senate Bill 93, please press star 9 now to take your place in the queue. Chair, there are no callers in opposition at this time.
Thank you. Can we see if we have any callers on the line in the neutral position on this bill?
Certainly. Thank you, Chair. To testify in neutral on Senate Bill 93, please press star 9 now to take your place in the queue. Caller with the last 3 digits, 552. Please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Good morning. This is Phil Burrell, Deputy Administrator, here for Division for Healthcare Financing and Policy. As you heard me speak earlier on Section 3, I also wanted to just provide testimony here in the neutral regarding the fiscal note. I did speak on Section 3 earlier, but I did also want to add interest regarding Section 2. So Section 2 for this bill requires the division to allow for a self-directed model for personal care services, PCS. Potential recipients of this program include waiver recipients who are currently receiving attendant care services. The division would use a contracted fiscal intermediary to assist recipients in managing the budget for their self-directed PCS. The contractual costs would include an initiation fee of $54.25 and an ongoing monthly fee for a recipient of $49.45. These rates are based on a Arizona Medicaid rates model of a similar program. Note that although the BR's effective date for this section is July 1, 2021, we wanted to highlight that the start date would be January 1, 2022, based on the fiscal note used here for the fiscal impact because of the changes to a waiver service, as they must go through the Centers for Medicare and Medicaid Services, and any significant changes cannot be retroactive. Additionally, to go with that process, there is a 30-day public notice that is required for any change to a waiver application, and it will take a little time to get that completed with the fiscal intermediary contract in place prior to starting the program. Thank you.
Once again, we are on neutral testimony on Senate Bill 93. If you have recently joined the call and would like to testify in neutral, please press star 9 now to take your place in the queue. Chair, there are no more callers in neutral at this time.
Thank you. I would also like to note that Senator Dennis has joined, and I think with no further questions and no further testimony and support, opposition, or neutral, we can close this hearing on this bill. And I want to thank Senator Settlemyre for presenting his bill this morning, and also thank Senator Hardy. And have a good day. And we'll move on to the next agenda item.
Thank you, Chairman.
Our next agenda item is Senate Bill 185. And Senate Bill 185 makes an appropriation to the Department of Veterans Services to provide financial assistance and support for the Adopt-A-Vet dental program. We have Kat Miller from the Department of Veterans Services, Amy Garland from the Department of Veterans Services, and we also have Linda High and Demetrio Gonzalez, all here to present this morning. And so I believe, Ms. High, you were going to, I'm sorry, before I get into this bill, Senator Kiefer, did you have something that you wanted to bring up or a question?
I don't think so, sir.
Oh, okay. I'm a little confused. Sorry about that.
I might be confused as well. It's Monday.
In that case, so Ms. High, I think that you had a presentation that you wanted to walk us through this morning.
Yes, thank you. Good morning, Mr. Chair and committee members. For the record, my name is Linda Haig, President and founder of the Adopt-A-Vet Dental Program. Testifying with me today will be our Executive Director, Demi Gonzalez, a retired Navy veteran and a Gold Star family member, and Dr. Thomas Myatt, one of our Adopt-A-Vet oral surgeons and our dental clinic director. First, we would like to thank you for the opportunity to speak today in support of Bill SB 185 and for the past years of support you have given to our veterans and the Adopt-A-Vet dental program. We would like to start our testimony with a short video that represents Adopt-A-Vet and the veterans we serve.
Video.
Our mission is to provide critical dental care to our low-income veterans in dire need. And for the past 11 years, we've had the privilege of doing just that. But we have incredible help from our volunteer dentists and specialists, grantors and donors, and most importantly, appropriation funds from the state for the last almost 4 years. Because the qualifications of dental care are so restrictive at the VA, the vast majority, 90% of our veterans do not qualify. This has led to an epidemic of oral health disease among our veterans. And Adopt-A-Vet targets the low-income veterans who don't qualify and cannot afford to see a dentist. In Northern Nevada, we have a large number of veterans going to the VA hospital in Reno. What we don't have is a school of dental medicine like UNLV in the South. There, veterans can go to the school's dental clinic 5 days a week for low-income dental care. And once a month, low-income veterans can go to the Sergeant Clint Farron Clinic for dental care at no cost. This clinic can accommodate approximately 65 veterans at one time for dental treatment. So, in northern and central Nevada, Adopt-A-Vet becomes the only viable option for our low-income veterans. And 98% of all our referrals come from the VA, but we receive no financial assistance from them. We are excited to report that 1,352 low-income veterans have received full restoration or emergency dental care to date. This includes 220 veterans living in the rural areas and 69 women veterans, two of our most underserved populations. We have 125 volunteer dentist professionals who have donated over $7 million in dental services, and we would not be able to have this program without their help. They now serve veterans in 14 counties of northern and central Nevada. Our veteran dental clinic at Truckee Meadows Community College was started in 2017 to assist our volunteer community dentists because we couldn't keep up with the demand of veterans needing dental care. The clinic keeps our wait list to around 100 veterans, which significantly reduces the wait time for our veterans. This clinic also allows us to care for our severe PTSD and military sexual trauma women patients who are now better suited to an open environment setting, as well as some of our other veterans. Now I'd like to turn it over to our Executive Director, Demi Gonzalez.
Good morning, Mr. Chair and committee members. For the record, my name is Demi Gonzalez, and I'm the Executive Director for the Adopt-A-Vet Dental Program. As a combat veteran and a Gold Star family member, I understand the sacrifices and the numbness that comes from combat fatigue and losing those closest to you. After 25 years and multiple tours as a combat medic, I have seen and felt the physical and emotional scars attached to such circumstances. During high-tempo patrols, there were no such thing as 8-hour workdays, scheduled meals, consistent sleep patterns, or knowing how the day or night would end. What we did know is we had to be alert, awake, and always have our head on a swivel. There is no organized way to do this, but I can tell you how the men who I served with did it. 99% of the time, most of the men had some type of tobacco product in their mouth for days on end to stay awake. Usually water was replaced with extreme doses of caffeine through different caffeinated drinks. This was not ideal, but under the circumstances, it is what kept us awake and going. Soon healthy meals were replaced with the aforementioned. What most people who have never been through war don't understand is that emotionally, these unhealthy patterns become solace and refuge once they return back to the States. This is something that they knew that they dealt with during combat time. This has caused a significant dental crisis among our veterans returning home. I do remember on every homecoming the support that I personally was greeted with, especially when I escorted my brother's body back from Afghanistan to my parents' arms. But to this day, this is not what breaks my heart the most. 70% of the patients that we treat are Vietnam veterans. They were not greeted or treated as I was during my homecomings. The heart-wrenching memories and stories that they share with us is enough to make anyone scream in anguish on how these men and women were treated. Even today, these very same men and women are denied basic dental care at the VA. With the funds that we have received from the state that you have so graciously given to our program has allowed us to remedy their hurt and feeling of abandonment from their own country. When we complete their dental work and they look at themselves in the mirror and are in tears, confused at whom they are looking at, is enough to have faith in humanity once again. I am asking for you to continue to support this program. During COVID, most of these veterans who had some type of communication with other veterans seems to exist. They don't have that. They haven't had that for the last year. And when they come to a dental appointment in our organization, sometimes that's the only people that they've seen in the last 6 to 8 to 9 months. Despite being shut down from May 11, 2019 to September 26, 2019 for clinic reconstruction, and from March 11, 2020 to June 24, 2020 due to COVID-19, AAVD was still able to complete 81 veterans with full restoration and 26 emergencies for the year, totaling 107 veteran cases. From July 1st, 2019 to February 28, 2021, AAVD has completed 207 veterans and has provided over 1,053,000 in donated services to our veterans from the gracious dental professionals out in the community and the retired professionals that we have working at the clinic at TMCC. Even though with all these closures and what has happened with COVID, our department and our organization took it upon themselves to do whatever we could to fight whatever was trying to make us not succeed. Because of the changes that we made and the reconstruction that we did in our organization, AAVD is on track to surpass COVID numbers in spite of 8 months of clinic closures in the community and AAVD. 8 months. 8 months with your help, we've been able to, by the end of this fiscal year, we would have surpassed any numbers prior. From July 1st, 2019 to February 28, 2021, AAVD has completed 19 women veterans and 24 veterans living in rural areas, surpassing our promise to the state last session to reach up to 15 or more of these underserved veteran populations. The stories that we hear when these veterans are done with the treatment, I can't. Excuse me. It's too much to ignore. I thank you for the support that you've given us, but I'm asking for the continued support to this program. And I invite every single one of you, if you have time, to come and visit us during a clinic session or to visit us when we're doing our in-processing of these veterans and hear the stories that they continue to have on being denied basic dental care. With that, I thank you for your time. And I will give the time to Dr. Mike, who's a clinic director at our dental clinic at TMCC.
Thank you, Mr. Gonzalez. Appreciate that.
Good morning. Thank you for the privilege of addressing legislature. My name is Tom Might. I've been an oral surgeon in Reno, Nevada for the past 40 years. When I retired, I devoted most of my time to the adoptive ed dental clinic and program. And Linda and Demi asked that I say a few words about how bad these veterans really are. All I can say is that after working for 4 years in the office, some of these guys are the worst I've ever seen. Because of their financially compromised situation and an inability to get dental treatment in the private community, they have not had any dental work or treatment for decades. And most come in with comorbidities of heart disease, diabetes, COPD, obesity. They really can't eat properly because they don't have teeth to eat with. Their teeth are broken off of the gum lines. They have dental abscesses, dental infections, periodontal disease. And as Demi said, a lot of social stigma because they walk around with their hands over their mouth because they're embarrassed. Most of our work is extractions. Sometimes if we can save some teeth to support a partial denture, we save teeth with crowns and crown and bridge. We have over 125 dentists in the community that assist us in treating these veterans, and we restore their mouths with partial and complete dentures and crown and bridge. We restore their function, and we restore their smiles. And as you can see some of the pictures on the video, that really makes a difference in their lives. Also, I think we've saved some lives because some of the infections that I've seen are so horrific that many of these patients are on the verge of actually getting into the hospital. IV antibiotics, general anesthesia, sometimes tracheotomies because of the dental infections and the swelling. So, I would ask that we could continue this program for these veterans. It's been very, very gratifying for me to be able to treat this group of underprivileged people that have supported our nation and our freedom. So with that, I'm going to give it back to Linda Haight, and thank you so much for your time this morning for our plea for help. Thank you.
Sir, thank you very much. Could you, before you step away, could you spell your full name? I didn't catch it. I'm sorry.
Thomas Myatt, Myatt.
Thank you so much for what you're doing for our veterans. I appreciate that, Mr. Myatt.
Receiving state funding has made an incredible impact on helping to save and transform the lives of our veterans. Once we can get them out of pain and suffering from decayed teeth, it improves their overall health. When we restore their smile, it gives them the confidence to be productive members of the community by volunteering and/or seeking employment. Therefore, we are asking for your consideration to consider funding Adopt a Vet for $250,000 per year or $500,000 for the biennial, which is 37.7% of our total projected budget. These unrestricted funds are essential for the continuation of our program because most foundations and grants do not cover the cost for staff salaries, administration, or even operational expenses. In closing, your funds have given us the ability to treat more veterans and in a more timely manner. Since July 1, 2017, when Adopt a Vet first started receiving state appropriation funds, our joint efforts have provided dental care to 460 low-income veterans. And we want to thank you for helping us to give them a better quality of life. Together, we have become the solution to this overwhelming challenge of oral health disease among our low-income veterans. Thank you for your time and consideration in support of Bill SB 185.
Thank you, Ms. High, and I appreciate all you do to advocate for our veterans and on this very important issue. And thank you, Mr. Gonzalez, for your advocacy as well and your service to our nation. And I would like to, before I turn it over to the committee for questions, I know we have Senator Hardy on the line, and this bill came from the Legislative Committee on Senior Citizens, Veterans, and Adults with Special Needs, and I believe Senator Hardy serves on that committee. And just wanted to know if you had any comments, Senator Hardy, before I turn it over to the committee for questions.
Thank you for your graciousness, Mr. Chair. I appreciate it. I've been involved with this particular bill for some time, but I've been impressed with the health improvement as well as the psychological improvement with these veterans who now can eat, chew, smile, grin, and not scare people. Huge difference. And the committee that we had in the interim was very firm that this was something that we would like to put forward. So I appreciate the committee's indulgence in allowing this to happen. Thank you.
Thank you, Senator. Thank you for bringing this bill forward. And if I could turn it over to the committee, if they have any questions for any of our presenters this morning. I am seeing none, and so I appreciate your thorough presentation. And many of us are very familiar with this program, and it's a great program, and we appreciate you bringing this forward. So without seeing any questions from our committee for any of the presenters, I would like to now go to the phones and see if I have anyone on the phones in support, in opposition, or in the neutral position. And we'll start with the support position, please.
Thank you, Chair. To testify in support on Senate Bill 185, please press star 9 now to take your place in the queue. Caller with the last 3 digits, 747. Please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Chair Brooks and committee members, my name for the record is Andrew Lee Pilbit, last name Lepeilbet. And I am the representative of our combat wounded veterans in the state of Nevada that are Purple Heart recipients, 70,000 disabled American veterans in Nevada, and I'm the current chair of the United Veterans Legislative Council. I think most everything's been said that needs to be said here. This is an absolutely essential need of our unfortunate or underprivileged veterans within our state. And it's not just the older Vietnam vets. We have a lot of young vets that have done multiple tours from our Guard and military in our state. And this is truly needed by each and every one of them to get them more productive back in our society. So we endorse this bill, SB 185 fully. Thank you very much.
To testify in support on Senate Bill 185, please press star 9 now to take your place in the queue. Chair, there are no additional callers in support at this time.
Thank you. Could you see if we have anyone in opposition on the line?
Certainly. Thank you, Chair. To testify in opposition on Senate Bill 185, please press star 9 now to take your place in the queue. Chair, there are no callers in opposition at this time.
Thank you. And could you see if there are any callers in the neutral position on the line? And then I do believe that we have Cap Miller on our Zoom as well to testify in the neutral position. So let's go to the phones first.
Certainly. Thank you, Chair. To testify in neutral on Senate Bill 185, please press star 9 now to take your place in the queue. Chair, there are no callers in neutral at this time.
All right, so Ms. Miller, please go ahead.
Thank you, Chair Brooks and members of the committee. This is Kat Miller, Director of Veteran Services for the state of Nevada. I wanted to share that since 2015, essential dental care for low-income veterans has been identified as a critical need during Nevada's Veteran Legislative Symposia, as most veterans are not eligible for VA dental health services, and that NDVS has administered the Adopt-A-Vet dental appropriation in the past and has the ability to do so in the future should this bill be passed. And sir, that is all I had for the committee.
Thank you, Director Miller. Appreciate it. And I believe that wraps up our testimony and questions and presentation on Senate Bill 185. And close that hearing on Senate Bill 185 and move on to our next agenda item. So thank you very much for presenting this important issue this morning.
Thank you.
Thank you.
Thank you.
All right, so our next bill, the last bill that we'll be hearing is Senate Bill 233, which makes an appropriation relating to health services in underserved areas. I believe that this bill was sponsored by Senator Hardy. Joint sponsor is Assemblywoman Titus, and both of them are here to present this morning. And so please go ahead whenever you're ready.
Thank you, Mr. Chair. I would defer to Dr. Assemblywoman Titus to tell the good story. And then I think John Packham and Gerald Ackerman may be on the phone if they want to chime in. Bottom line is this is a way to get more medical practitioners in low penetration of medical opportunity people in Nevada. So this is something that has worked and is working, and it would be a good thing to get the matching federal dollars when we do it. So I would defer to Dr. Titus at this point. She's ready.
Thank you, Chair Brooks. If I might go ahead and start then. Thank you, Senator Hardy, for asking me to co-sponsor this bill. And thank you, Senator Brooks and members of the Senate Finance to hear SB 233. I'm Assemblywoman Dr. Roma Titus. I represent District 38, which is in Churchill County and most of Lyon County with the exception of Dayton. I'm sure it comes as no surprise to those of you on this committee that Nevada ranks near the bottom or at the bottom in most healthcare bad rankings. One of those is provider ratios to patients, especially prominent in rural areas, but also in underserved urban areas. This bill offers a true solution. I'm here to testify that financial assistance with requirements works. I want to briefly share my story. I grew up in Smith Valley, not too far away from here, about 50 miles to the southwest. My family was very poor. My father made $3,000 the year I graduated from high school. They furnished a lot of love, but no financial support. I made it through school, undergraduate school, working 3 jobs and having scholarships, literally 3 jobs. After I was accepted into medical school, I was able to work nights my first year, but then medical school owns you. You don't get holidays off, you don't get summer breaks. And when I started my clinical rotations, I had to figure out a different way. Many of you may know that being a family practitioner in a small town is probably the lowest reimbursement for most of the medical fields. A large financial debt would not have allowed me to return to my beloved Smith Valley. So I came up with an idea. I either had to join the military or, again, undergo a lot of debt. So I came up with this idea to reach out to my county commissioners. Hadn't been done before, but I met with them and said, hey, I want to come back. But here's what's going to happen if I have to go into debt. So they agreed to support me my last 3 years of medical school. They paid for my tuition, and they gave me a small stipend to live on. In return, I owed them 3 years of medical practice, guaranteed to stay in the rural area. Well, many of you know I stayed there 36 years, and it was a win-win for everybody. Now, enabling me to be here in Carson City and not in that practice, I have a medical doctor, graduate from University of Nevada, Reno, who came from Gardnerville, and a physician assistant who grew up in Yarrington. Also, both of them were assisted by this program. And as you may know already, there's been a letter submitted by the medical department that showed that this program started in 1989. And that, please look at that if they're not going to display it, but there's a picture in that attachment that shows where these providers have gone based on this program. And I'm sure they're available to explain it some more. But again, it's not just rural Nevada. Senator Brooks and I, we bring up a lot about where does this money go? Who does it help? And this is a true program that reaches far and wide throughout the great state of Nevada, and especially urban underserved areas too. So I appreciate your support. I appreciate you hearing this bill and understanding the importance of it is to our state's medical providers. So thank you, Senator Hardy, for allowing me to participate. With that, I'll turn it back to Senator Hardy.
Thank you, Dr. Titus. I appreciate that. And Senator Hardy, please go ahead.
So this is a matching money and looking at federal grants to do it. But the folks that are on the line, John Packham and Gerald Ackerman, probably can help elucidate any other questions you might have. But there is a exhibit that looks at the map of Nevada with 13 counties having received this Nevada Health Service Corps grants, and it's basically a loan that is paid back by working, where you qualify for a shortage area. And it works, and obviously we would like to keep it going. So if John Packham or Gerald Ackerman are around, we'd love to hear from them.
Sure, I'll start off. Good morning, Chair Brooks and committee members. For the record, I am John Packham. I'm Associate Dean for the Office of Statewide Initiatives at the UNR School of Medicine. I also co-direct the Nevada Health Workforce Research Center, and many of the programs overseen by my office deal with workforce. Our view is that it's important to note where we've made gains in insurance coverage and improving access. If there's not a provider able to treat that individual, access is impeded. And to try to provide a little bit of a backdrop of why we think this program is important is to give a little bit of the, again, give you just a few facts about the scope or magnitude of workforce shortages. About 1.8 million Nevadans reside in a primary care shortage area. That's about 60% of the state's population, including 1.4 million in Clark County alone. 1.4 million Nevadans reside in a dental shortage area. That's about half of the population. And then finally, and probably the most alarming, is the 2.8 million Nevadans that we estimate reside in a mental health professional shortage area. And that figure includes 100% of the Clark County population. That's the bad news in the enduring health workforce challenge facing Nevada. The good news is that we have a number of policy levers to not only attract physicians and other health practitioners to the state, we have some pretty effective strategies to keep them here. One of those is the Nevada Health Service Corps, and my colleague from ELCO, Gerald Ackerman, will give you an overview of that program. Gerald.
Thank you. And Chairman Brooks, Gerald Ackerman, Assistant Dean of Rural Programs. So the program has been around since 1989. We have an appropriation within the School of Medicine for $250,000. A couple of years ago, they increased the amount of award that we were eligible to apply for, and graciously Senator Hardy helped us to get that match, and we increased that amount to $500,000. So we've got about $1 million each year to apply towards health professionals within the state of Nevada. A student out of our graduate out of this program for the first 2 years signs up for 2 years. They receive $50,000. That is tax-free money, so a little more incentive because it comes through the state of Nevada. They provide those 2 years of service, and then if they continue to have eligible debt and we continue to have resources, they are able to apply after that initial 2-year obligation for a year-to-year loan forgiveness program. And we have actually had providers who have gone all the way through, paid their loans off, and then continue to remain in the community because it gives them a mortgage and kids in school and all those things that happen once you've been in a community for a while. For those of you who have, I won't go through all the eligible practitioners, but it's quite an array. 2 years ago, because of the opioid crisis, a lot of mental health professionals were added to this program, and that included licensed licensed folks to work in the alcohol and drug abuse treatment programs. Eligible sites are small rural hospitals, FQHCs, RHCs. The minimum requirement for the facilities to participate in this program are they have to take Medicaid and Medicare. They have to take those regardless of their ability to pay. So if they're on a slide or something like that, and And then our sites have to agree that they pay them prevailing wage. So they cannot come in and say, oh, you're getting loan repayment, we're going to reduce your salary by $50,000. No, this has to truly be an incentive for them. The map shows you currently with the last appropriation. I hope you can all see that. It's been handed out to you. These are our current participants from our last biennium, and it's made quite an impact on the state. Right now, 13 counties are currently being supported by Nevada Health Service Corps candidates. I was in a meeting with Senator Ratty and with the Director of Health and Human Services who informed us, and we're looking into it and have been reached out to by our project officer, that somewhere buried deep within the new funding is the potential for additional funds that programs can apply for that aren't requiring match. So they actually are looking at maybe helping states a little more who have current programs and providing them additional funds, but not requiring, at least on that additional money, for some match. So, this would be a great opportunity to continue this program forward and get some maybe additional bang for our buck. I don't know how well we would look if we were cutting the program by $250,000 and then going in, and how well we would compete for those additional federal dollars that we would not have to state match. And I'd be happy to take any questions. Hopefully that was quick and a good overview for you.
Thank you, Mr. Ackerman. Senator Hardy and Assemblywoman Titus, is the entirety of your presentation, and I can turn it over to the committee for questions?
That'd be fine. Thank you, Mr. Chair.
All right, so any of the committee members have any questions for the Assemblywoman, the Senator, or the presenters this morning? Well, I see none, so that was a thorough presentation on an important program, and I appreciate you bringing this forward this morning. I don't have any questions myself, and so if you have any closing comments, Assemblywoman Titus or Senator Hardy, before I turn it over to the phones for any question or testimony in support, in opposition, and neutral.
Any closing comments would be redundant. It's a good program, makes sense. Appreciate it. Thanks.
And thank you, Senator Brooks and committee, for hearing this. And again, since its inception in 1989, it has made a difference for all Nevadans. So thank you very much.
Thank you, and thank you for your personal experience with this and your service to Nevada. So with that, I will turn it over to the phones, and we'll start with testimony and support, please.
Thank you so much, Chair. To testify in support on Senate Bill 233, please press *9 now to take your place in the queue. Caller with the last 3 digits, 548. Please slowly state and spell your name for the record. You will have 2 minutes and may begin.
My name is Joan Hall, Joanhall. I represent the Nevada Rural Hospital Partners. Mr. Chair and members of the committee, I appreciate your consideration of this funding request this morning. These loans have historically assisted in recruiting of healthcare providers, thus increasing access to care in the most underserved communities in Nevada. It is important to emphasize, as you've already heard, that these providers who are receiving the loans must accept Medicare, Medicaid, and uninsured patients. It is also important to know that every penny of these funds goes directly to the loans. There is no administrative fee. We really appreciate your consideration of this very important funding consideration. Thank you very much.
To testify in support on Senate Bill 233, please press *9 now to take your place in the queue. Chair, there are no additional callers in support at this time.
Thank you. Can we see if we have anyone in opposition to Senate Bill 233?
Certainly. Thank you, Chair. To testify in opposition on Senate Bill 233, please press *9 now to take your place in the queue. Chair, there are no callers in opposition at this time.
Thank you. Can we see if we have any callers in neutral, please?
Certainly. Thank you, Chair. To testify in neutral on Senate Bill 233, please press *9 now to take your place in the queue. Chair, there are no callers in neutral at this time.
Thank you. Well, that brings our presentation hearing on Senate Bill 233 to an end. And so I can close the hearing and thank you, Assemblywoman and Senator and all the presenters for presenting that to us this morning. And I will, with that, move on to our final agenda item of the day, which is public comment. Broadcast services, could you open the public comment line? And we'll give a few minutes for any public to call in and get on to make any comments.
Certainly. Thank you, Chair. We are currently on public comment. If you have recently joined the call and would like to provide public comment, please press *9 now to take your place in the queue. Once again, we are currently on public comment. If you have recently joined the call and would like to provide public comment, please press *9 now to take your place in the queue. Chair, the public line is open and working, and there are no public comment callers at this time.
Thank you very much. Well, that brings our agenda today to an end, and I would like to adjourn this morning's meeting.